With sweeping new measures in America's three most heavily populated cities to try and slow the coronavirus. New York City is now setting up coronavirus checkpoints for people entering from hotspots. Chicago says all its public schools will use remote learning at the start of the new school year. And Los Angeles announced a crackdown on house parties and threatened to cut off water and power. We start with our lead national correspondent, David Begnaud, who's in Miami. David, first tell us about this enforcement effort in L.A.
So, Jeff, if the city of Los Angeles now gets a report and they can confirm that there is a large gathering of people at a private property, they are going to ask the utility service in Los Angeles to cut water and power to that property within 48 hours. Now, this drastic decision follows a party earlier in the week near Beverly Hills where the police could clearly see and cameras showed people gathering together at a large party. Here in the South, where we are, the virus is spreading out of control. And we want to zero in this morning on the state of Mississippi, which is leading the nation in a way that they don't want to. Cases per capita are the highest in Mississippi than anywhere else, and doctors are alarmed. This was the scene inside of the ICU at the University of Mississippi Medical Center in Jackson yesterday. It is Mississippi's largest and most specialized hospital. It is the only one that can offer the complex medical procedures that most critically ill patients need, and it is completely full.
Within our walls, we have 14 patients that need an ICU bed, and there is not one available.
That is Dr. Lou-Ann Woodward. She is the Dean of the School of Medicine at the University of Mississippi. She says with cases on the rise and nearly 25% of the cases coming back positive, the current crisis in Mississippi may go on for months.
I'm hoping the tide is turning, but I think there has been a very deep disconnect between many people in Mississippi and the understanding of what we're seeing.
In neighboring Louisiana, there was a prayer service held at Turlings Catholic High School in Lafayette for 19-year-old Davidlemare. We spoke to his father, Mark. How many of your children were infected by the virus?
4 out of 5.
Were you and your wife infected?
Yes.
David and his younger brother Jacob were both hospitalized with coronavirus and put in the same ICU. At one point, the brothers even shared the same room. That is where David took this picture of Jacob looking back at his brother with clear concern in his eyes. Why did they bring him in the room together at one point?
Because David's condition had deteriorated, and they're very close, and they thought that would be good for both of them.
David was airlifted to New Orleans for more complex medical treatments. Mark went with him, seen here by David's side holding his hand as machines oxygenated David's blood to give his lungs a rest. But the virus had ravaged this 19-year-old's lungs beyond repair. David died on July 31st after more than 1 month in the hospital.
My son David was a very, very vibrant, very alive college student. I've learned a lot about my son and about how compassionate he was and how deep his faith was. This loss is just, overwhelming, obviously, for our family. I told Mark that one of David's high school teachers told me that David is remembered by his high school as being one of the nicest kids on campus. What a beautiful thing to be remembered by. Listen, I want you to know that David was treated with every drug available, remdesivir, convalescent plasma, steroids. They gave him everything they could. Vlad, David had asthma as a child, but hadn't been treated with medication since the 5th grade. He ran cross country in high school and was running several miles a day the week before he was infected with the virus.
David, you're reporting once again driving home the fact that no one is safe from the coronavirus, and we should all take precautions. As you've reported, wear a mask. Thank you, David Begnaud, for us. We appreciate it.